Based on extensive evidence, BMI appeared to be the only anthrax supplier staffed with the resources, human and otherwise, capable of producing the hyper-weaponized anthrax that was mailed. BMI developed a specific AIM strain of powdered anthrax that was twice as concentrated as anything the Soviets had ever produced. Plus, it was electromagnetized to spread easily and rapidly. This work was done under a top-secret CIA bioweapons program, an anonymous Pentagon official called Project Jefferson. William Broad of the New York Times twice reported this project was named Clear Vision. I telephoned William Broad after emailing him for months. We spoke of Battelle's labs in West Jefferson, Ohio, as a leading institutional suspect with ties to the drug cartel and the anthrax vaccine maker, Bioport. BMI also administered the U.S. military's Joint Vaccine Acquisitions Program, a multi-billion-dollar enterprise. Extensive efforts were being made before and after the mailings to get governing officials to approve of a $250 million anthrax vaccine purchase from Bioport. Meanwhile, congressional investigations had proven Bioport grossly negligent in vaccine quality control. The sole supplier of anthrax vaccine was completely untrustworthy, according to congressional records. The private Bioport company was directed by a wealthy Saudi with banking and suspected terrorist ties, as well as military and presidential ties through U.S. Ambassador to England, William Crowe, a retired Navy admiral. Crowe and friends evolved the company in association with Britain's primary biological weapons testing organization at Porton Down. In other words, Bioport was an American profit-making venture spun from a British government-directed war supplier. The Washington Post reported that the FBI learned about, but evaded, the BMI CIA defensive project. This, despite the fact their bio-warfare contract involved a precise strain of anthrax that was mailed. So what's really going on here? The press and the FBI were aware that Battelle had contracted with the CIA operative and anthrax expert, our good old Grand Dr. William Patrick III, to prepare a report approximately 2 years prior to the anthrax mailings on what this precise germ's capability and lethality would be if mailed. This would not have been done unless someone in that organization had not foreseen its use in the very way it was used, for bioterrorism, to generate fear and financial rewards.
Freedom and fear are at war. The advance of human freedom, the great achievement of our time and the great hope of every time, now depends on us. Our nation, this generation, will lift a dark threat of violence from our people and our future.
This reality check implicates our government's most powerful intelligence agencies in a conspiracy to commit murder, treason, military-industrial sabotage, and bioterrorism, a profitable media-supported form of genocide. In summary, Dr. Kano's primary expert testimony for this history of bioterrorism comes from the two men most suspiciously linked to the deadly anthrax mailings. No other suspects would be so capable, nor high-tech hardware available to them, to bioengineer this hyper-concentrated, electromagnetized, and silica-sensitized mutant that would spread, carry, and kill far better than anything the world had ever seen. Next, let's return to Dr. Kano, who will inform you about becoming enlightened to the risk of dying from a bioterrorist attack without being frightened. Her mixed message is allegedly provided to prepare you for such an attack by visiting the government's propaganda mill at www.ready.gov. Here you are given simple preparedness instructions that include buying prepaid calling cards. Then it's time for a commercial break. Watch these commercials that especially target black people. Health officials justify targeting African Americans with their messages more than whites due to increased diseases among blacks. But there's a lot more to this story, as you will soon learn.
In October of 2001, the United States experienced anthrax attacks using powder sent through the United States Postal Service. 22 people got sick and 5 people died from this attack. We learned just how dangerous anthrax could be. But there are things we can do. The best defense against a bioterrorism attack is knowledge and preparation. The webpage ready.gov is a good resource for preparedness information. It can be found at www.ready.gov. Visit this webpage for detailed guidelines, facts, and what you can do to be ready in the event of an emergency. A small amount of time spent becoming informed, developing a plan, and preparing yourself against terrorist threats now can prove to be invaluable should the need arise. Don't be afraid. Be ready.
My mom made the decision for them to be screened for colon cancer. Grandpa! They found polyps, and they were able to remove them before they developed into cancer.
Beautiful day.
When I see my daughter with my father, I feel grateful that he's here.
Spin doctors for the CDC and their propaganda ministers are very skilled. They know precisely what moves people to act. In this commercial, it is simply love of life and family. So I wonder if your family values include this: National Security Memorandum 46, a specific genocidal campaign administered by the CIA to target black nationalists and other opposition groups, not terrorist groups, in America. This was an extension of what the FBI's assignments were under COINTELPRO, directed by J. Edgar Hoover. Were these programs simply part of Kissinger-Rockefeller population policies aimed at sustaining white supremacy, generating class warfare, controlling working class numbers, and squelching effective black activism? This is, after all, why modern genetics began at Cold Spring Harbor Labs in New York, affiliated with Rockefeller University. They called this population control movement eugenics. Indeed, eugenics was pioneered and funded by the Anglo-American ruling elite, the old money families, the wealthiest industries directors, and yes, even the Bush family was represented here by Prescott.
Has Struckhold arrived?
Yes. They're waiting in the library, sir.
We began to worry. Some of us have traveled so far, and you are the last to arrive. While we've been made to wait, we watched surveillance tapes, which have raised more concerns.
More concerns than what?
We've been forced to reassess our role in colonization by new facts of biology, which have presented themselves.
The virus has mutated.
Into what?
A new extraterrestrial biological entity.
My God.
The geometry of mass infection presents certain conceptual re-evaluations for us about our place in their colonization.
This isn't colonization. This is spontaneous repopulation.
Eugenicists' primary reason for funding population planning and genetic engineering was to control ethnic and black populations that potentially posed threats of popular uprisings and labor revolts, as further detailed in Kissinger's National Security Memorandum 200. The controllers of politics and profits are not stupid. They were aware of, even boasted, advances in biotechnology on the cutting edge of, quote, cancer research, and, quote, instead of the politically risky objective of population control. For such a kind and gentler nation, sourcing from 1,000 points of light, here is a compelling revelation. A public biological weapons experimentation license granted by the United States Congress to researchers under contract with the military intelligence organizations, including the CIA and DARPA.